Hi there, this is Lindsey Lopez from Southeastern Physical Therapy. I'm joined today by Dr. Michael Higgins from Tidewater Orthopedics. Thank you so much for joining me, Dr. Higgins. How are you doing today?
I'm doing great. Thanks for having me.
Absolutely. So I'd love to spend some time just talking about hip replacements. What exactly is a hip replacement and what does it involve?
Well, hip replacement's a treatment for hip arthritis. And the surgery involves replacing the ball of the ball and socket joint and resurfacing the socket. So the hip replacement is an implant that replaces the ball that's removed. All the arthritis in the hip is removed, and a titanium cup is put in the native socket, and a ceramic head ball goes in to replace the head ball you were born with.
Okay. So when do you, as a physician and surgeon, know that a hip replacement is kind of the necessary next step for a patient?
Well, there's two major things. The first thing is patient symptoms. I think that's the biggest thing, and most patients tell me when they need a hip replacement because they're having a lot of pain. But of course, x-rays also are very helpful. And those are the two major factors. If there's significant arthritis on x-ray and patients having significant pain and difficulty from their arthritis.
Okay. So what can a patient expect when they're recovering from their hip replacement surgery?
Well, when you have your hip replaced, most people actually bounce back fairly quickly. I do the direct anterior approach, which is a way of replacing the hip without cutting any muscles. So while the surgery is the same, the implant that's used is the same, surgery is less invasive. So most patients are up walking the day of surgery. Most patients will go home the same day or the day after. So either home the same day or just one night in the hospital and then home. Most people are walking with a cane or nothing within a week. Most patients are comfortable driving about 10 days after surgery. So things move along pretty quickly. But the other side of the coin is that when you have your hip replaced, it will keep improving. It will keep getting better for somewhere between 12 and 18 months. It will take that long for it to get to as good as it's going to get.
Okay. So in kind of that healing process post-surgery, how important is physical therapy following the hip replacement?
Physical therapy is very helpful. I have all my patients do therapy after hip replacement surgery. At a minimum, I like everyone to do 2 or 3 weeks. And that's helpful for two main reasons. I think it keeps people that are very, very cautious from doing too little. It helps build their confidence in what they can do. And on the other end, patients that are doing too much, it helps kind of bring them down to reality and keep them from, needlessly aggravating their hip. So therapy is a very important part of the recovery.
Okay. So Dr. Higgins, where do you typically see patients?
Well, I have 3 locations that I see patients in. We have an office in Williamsburg, an office in Hampton, and one in North Suffolk.
Okay. And how can a patient set up an appointment with you and your office?
The easiest way to make an appointment is right on our website. Patients can make their own appointment from our website at tidewaterortho.com. And right on the website, they can pick a time and set the appointment online, or if they prefer to call our office to set it up an appointment, they could do that as well.
Okay, wonderful. Well, thank you so much for your time today. I really appreciate it.
Thank you.